Hello everyone, I'm Lucy. Today, I would like to talk about my domain modeling for gestational trophoblastic neoplasia. First of all, let me introduce this disease briefly. Gestational trophoblastic neoplasia. In this video, I will call it GTN. Is a group of malignant conditions associated with abnormal pregnancy. It includes invasive and metastatic mole, as well as the malignant choriocarcinoma, placental site trophoblastic tumor, and epithelial trophoblastic tumor. As we know, histologic diagnosis is essential for the diagnosis of most malignant tumors. However, GTN can be diagnosed only according to patient's history and exams. Histologic verification is desirable, but not essential. So the collection of patients' history and exam results is very important for its diagnosis and treatment. GTN can be cured by chemotherapy. Its cure rate is greater than 19%, even in the presence of widespread metastasis. The FINGO guideline for trophoblastic disease is used to treat GTN by physicians all over the world. However, irregular chemotherapy can cause resistance to treatment or progression, which can lead to death. Therefore, the FINGO guideline suggests that GTN needs to be treated by physicians who are experienced in the management of these diseases. There are some problems of diagnosis and treatment for GTN. Lack of experienced physicians is a worldwide problem, and even the experienced physicians can fall out of date and make mistakes. Therefore, I'm going to design a clinical decision support system to assist doctors to diagnose and treat GTN more accurately, and to assist doctors to manage patients more efficiently and safely. I hope this system could also be useful training tool. This is the overview of my GTN CDSS. I will explain it in detail. There are 4 paths in my GTN clinical decision support system. You can see its users should be doctors in secondary or tertiary hospitals, including physicians and gynecologists. I put gynecologists here because in some countries, such as China, they are responsible for treating GTN. I hope there are updated guidelines and high-quality medical evidence in my system, which can be used to support output data and train doctors. So I put guidelines like FINGO guideline and NCCA side effects management guidelines, as well as useful formula and prescription details here. When doctors receive an alert or a suggestion from the system, but they don't know why, they can get the related information by using info buttons. This part could also be used as a training tool for doctors. For instance, when physicians would like to know something about a chemotherapy regimen. They can search it and learn about what kind of medications are involved, how to calculate their doses, and limited doses. In my system, inputting data is important. They are patient's details, which are the base of diagnosis and treatment. I also hope someday in the future, the system could provide suggestions according to both guidelines and the patient's big data. The input data includes patient ID information, history, and exam results, which can be extracted from the electronic health recorder systems and input by hand. The patient ID information includes patient's name, date of birth, medical recorder number, hospital number, and social security number. Above information can help doctors identify the right patients, and patient's symptoms, such as bleeding, pain, mice, and other complaints, as well as obstetric history, previous treatment, like field chemotherapy, should be collected carefully because they are closely related with the diagnosis and treatment. The patient's medical history can help avoid some risks. The exam results should also be input in the system. They include the physical exams, the lab testing results, imaging results, and pathology report. These results could help doctors assess the patient's health status and the severity of the disease. That means whether the patient could be treated by chemotherapy or not, which treatment regimen is the best. The output data part is what we want to get from the system. The accurate diagnosis could be made including stage and score. The system will do some check work before treatment to ensure patient's safety. It can check the contraindications for chemotherapy. Once some abnormal results of physical or lab testing examination are detected, the system will send alerts and refuse to offer chemotherapy. The system can also evaluate the effects and side effects of the previous chemotherapy. According to diagnosis and assessment results, the system will recommend treatment plans for chemotherapy. The plans would include prescription details and post-chemotherapy monitor schedule. In the part, the system will also predict the risks of side effects and set up reminders for the post-chemotherapy follow-up. The system can also provide other treatment suggestions, such as treatment for side effects or surgery if necessary. When the chemotherapy is finished, the system could offer a schedule of follow-up with the reminding and alerting function. Let's move on to the limitations. Firstly, when inputting data, the best way is to gain them from the electronic health recorder system. As a result, how to connect with all kinds of ejecting recorder systems and acquire the right data from this system is a problem. In addition, some recorder systems may not include all the patient's detail, which has been mentioned above. Although patient's details could be input by hand, but it would be hard work. Secondly, every day a large amount of medical guidelines and evidence are published. The healthcare and IT professional have to update the medical knowledge in the system on time. So maintaining the system is also a hard work. The last one is that doctors might get too much alerting or reminding information from the system, which would bother them. These are references. Thank you for watching.